the United States. I received my Doctor of Optometry degree from the University of California, Berkeley. I taught at a university in the US for a few years before moving to Hong Kong and joining the Hong Kong Polytechnic University School of Optometry as a clinical associate. In total, I've been teaching for about 13 years. I am mainly involved in teaching clinical skills, ocular pathology, and ocular pharmacology. Right now, I'm sitting in our clinical skills training laboratory where we make use of simulators for teaching clinical skills. I'd like to tell you about a new tool called the Virtual Optometry Clinic that we are developing. It aims to improve students' communication and analytical skills. First, I'll give you a little bit of background that led to the idea for the project. Case-based, problem-based simulation learning are all important components of any healthcare program. When we traditionally use this mode of teaching, students are given a patient history and exam data, which they analyze and discuss. However, this is a little different than the actual clinic setting, where the healthcare providers must draw out all the important information needed from the patient during the case history by asking the right questions. So the unique part of our virtual optometry clinic is that we use chatbots to respond as simulated patients. The students engage in a text-based chat with the virtual patients to collect information about the presenting symptoms and medical history. And then to conduct the examination, students type the test they want to perform, and the chatbot will respond with text, photo, or video. After the student has enough information about the case, they submit their diagnosis and management plan. After students have entered their individual answer to the case, they can go into a discussion forum where they can view their classmates' responses, ask questions, add comments, and even select emojis to highlight really good answers. So far, the response from students has been very positive. Compared to traditional teaching methods, students commented that the virtual clinic was more interactive, more student-orientated, less stressful, and more flexible in regards to time management. A benefit of this teaching strategy is that it can promote both independent and collaborative learning. The students can interact with the chatbots on their own time, at their own pace, and in their own space individually, and then they can join the discussion forum, which is a supportive online space where students can engage in peer learning and strengthen their ability to learn. This is the first year we have deployed this new tool. We are working on adding more cases and improving the current chatbots to make them better virtual patients. We're also hoping to expand it to other courses in the optometry program, as well as other departments at PolyU.